Welcome to another deep dive. This time, one that might make you think twice about how you look at a sore throat. We're going to be exploring Lemierre syndrome.
Oh, yes.
It's rare, but serious. And it can escalate.
Right.
Especially in young, healthy adults.
Interesting.
So we're going to be using Microbiology, the CDC, and MicroCanvas to kind of guide us through this.
Okay. Sounds good.
So,
yeah.
For medical microbiologists out there, it's really important to pick up on those subtle signs early on.
Absolutely.
Like really critical.
Yeah.
So let's just start with the basics. What is Lemierre syndrome?
So Lemierre syndrome is basically internal jugular vein thrombophlebitis, which is basically a blood clot that forms in the internal jugular vein, major vein in the neck. And this clot gets infected.
And what's crazy is that it starts with a sore throat.
Yeah.
A bacterial sore throat.
Right.
But not just any sore throat, right?
Yeah.
According to Microbiology and the CDC.
It's true. This isn't the, run-of-the-mill sore throat that's going to resolve in a couple of days.
Right.
In Lemierre's, the infection spreads beyond just the throat, causing some systemic complications. And we even see septic emboli forming.
Oh, septic emboli.
Yeah, septic emboli.
That sounds scary.
Yeah, they are. Think of them as like fragments of that infected clot that break off and travel through the bloodstream.
Oh, wow.
These little bacterial clumps, it can lodge in different organs and cause some pretty serious problems.
Well, let's kind of walk through what symptoms we might see. So it starts with the classic sore throat, right?
Right.
Fever, weakness, just feeling kind of crummy.
Yeah, malaise, just that general feeling of unwell.
Exactly. But then things kind of...
They take a turn.
Yeah. They take a turn, according to the CDC.
Yes, it can. Progress to extreme lethargy, spiking fevers, chills, noticeable swelling in the lymph nodes, and significant pain in the neck.
And here's the tricky part. These more severe symptoms, they don't always show up right away, according to MicroCanvas.
Right. Sometimes it can be days or even weeks after the initial sore throat.
Yeah. So that kind of makes it hard to diagnose, doesn't it?
It does. That delay is a big part of why diagnosing Lemierre's can be so tricky. Plus, there's other symptoms.
Okay.
Less obvious ones, like you might see abdominal pain, diarrhea, nausea, and vomiting. So these GI issues, they can really mask how serious the situation is.
Wow. So it really is kind of a diagnostic puzzle.
It is.
So while we're talking about symptoms, what are some of those rarer but serious complications that we might see pop up?
Well, remember those septic emboli? If they travel to the lungs, you might see shortness of breath, coughing, chest pain. It can even mimic pneumonia.
Thanks.
And in some cases, they can reach the brain, leading to meningitis.
Well, wow.
Septic shock is another big one, characterized by low blood pressure and rapid heart rate.
That is definitely not your average sore throat.
No, not at all.
So let's talk about what causes this. What are the main bacteria that are behind this whole cascade of events?
The most common culprit is anaerobic bacteria.
Okay.
Particularly Fusobacterium necrophorum.
Fusobacterium necrophorum.
Yeah.
Our listeners who are familiar with Microbiology might recognize that name.
Right.
It's a pretty common resident of the mouth and throat.
It is.
But as we're seeing here, it can become dangerous.
Absolutely. Under certain circumstances, it can definitely wreak some havoc.
So F. necrophorum is the usual suspect. But are there other bacteria that can be involved?
Yeah, you're right. F. necrophorum is usually the one we see, but there are others that can play a role too. Bacteroides fragilis, Staphylococcus aureus, and even Streptococcus pyogenes.
Wow.
And sometimes we see co-infections, which can make things even more complicated.
So let's kind of break down how this infection actually progresses. So it usually starts with an infection in the head and neck, right?
Right.
Often pharyngitis, which is highlighted in several studies. That's our initial sore throat.
Exactly. That's where it all begins.
But then what happens?
Well, here's how it unfolds. F. necrophorum starts to colonize the infection site, and then it begins to spread. Eventually, it reaches a space in the head and neck called the parapharyngeal space.
The parapharyngeal space, what is that?
It's kind of like a hidden pathway within the head and neck.
Okay.
And it basically allows infections to spread more easily.
Oh, no.
And unfortunately, F. necrophorum takes full advantage of that.
So F. necrophorum uses that pathway to spread, but then what?
Well, then the bacteria invade blood vessels in the area, and ultimately they reach the internal jugular vein. And this is where things really take a turn for the worse.
Why the internal jugular vein?
Think about where it is. It drains blood from the head and face, providing a direct route for the infection to spread even further.
Oh, wow. So the bacteria set up shop in the internal jugular vein.
Exactly. They trigger inflammation and the formation of a septic thrombus, which is basically a blood clot full of bacteria.
And is that septic thrombus where those septic emboli come from?
Exactly. Fragments of that infected clot break off, enter the bloodstream, and then travel to other parts of the body, causing those complications in different organs.
It's like a domino effect.
It is.
With really serious consequences. And then the body's response on top of that just makes things worse.
You're right. The toxins released by the bacteria trigger a systemic inflammatory response.
Right.
Which just further complicates things.
So we had the initial infection, the spread to the internal jugular vein, the formation of that septic thrombus, and then those septic emboli are just kind of going wild throughout the body.
It's a complex chain of events.
It is.
And it can escalate really quickly.
It really can. And that complexity is what makes diagnosing Lemierre so hard.
Exactly. It's not always straightforward.
So how do we, as medical microbiologists, figure out if this is going on? What do we need to look out for?
That's a great question. And it brings us to the heart of the diagnostic dilemma. The tricky thing is, Lemierre's can present in a lot of different ways.
And those severe symptoms we talked about, they can be delayed.
So it's not always so clear-cut.
Nope, not at all. And that's why it's so important to have a high index of suspicion.
Okay.
Especially when we're dealing with a patient who has a sore throat that just won't quit, and signs of sepsis.
So we need to be thinking, could this be Lemierre's? Even if it doesn't seem like it at first.
Exactly. We need to be on the lookout. A thorough patient history and physical exam are absolutely crucial. Asking the right questions, looking for subtle clues, that might point us in the right direction.
So we can't just rely on the clinical presentation. What other diagnostic tools can medical microbiologists use?
Yeah, we're going to need more than just the clinical picture. What about lab tests? What kind of lab tests would make us think of Lemierre's?
Blood tests can be really helpful, right?
Right. Elevated inflammatory markers like your C-reactive protein and erythrocyte sedimentation rate are often high.
Those are pretty general though, right? They are, true. But they can point us towards something more serious going on. A CBC might also show an elevated white blood cell count, especially neutrophils.
Okay, so those blood tests give us some clues. But what about actually seeing the infection?
Imaging.
Yeah.
Imaging studies are really key to actually confirming the diagnosis. Ultrasound's great for actually visualizing the internal jugular vein and seeing if there's a thrombus there.
So we can actually see that infected blood clot.
Yeah, we can see it. And if we're worried the infection's gotten into the lungs, a chest x-ray or CT scan can help us figure out how bad it is.
What about identifying the specific bacteria? I feel like that's really important for choosing the right treatment.
Oh, absolutely. Yeah. We've got to know what we're dealing with. Bacterial cultures are essential.
Okay.
We can get cultures from blood samples, joint aspirates if there's joint involvement, or from other sites, depending on what's going on with the patient.
And that helps us tailor our antibiotic treatment, right? Yeah. Especially if we're thinking about those co-infections that we were talking about earlier.
Exactly. It's all about getting the full picture. We've got to know all the bacterial bad guys involved to make sure the treatment works.
It sounds like medical microbiologists really are like detectives piecing together all of these clues.
We really are. We have to use our clinical knowledge, lab tests, and imaging to crack the case.
So we talked about blood tests and imaging. Are there any other conditions that can look like Lemierre's syndrome? You know, things we have to rule out?
There are a few things that can mimic it. Infections like Q fever, tuberculosis, even pneumonia can have similar symptoms. So we have to make sure we're thinking about all the possibilities.
A real detective story. But once we've figured out that it's Lemierre's, what's next? How do we treat it?
The big gun in treating Lemierre's is intravenous antibiotics.
Intravenous.
Intravenous.
So this is serious stuff.
It is. We've got to act fast because of how bad this infection can get and all those complications.
Makes sense. So what antibiotics are usually used? I'm guessing it depends on which bacteria is causing the problem.
You're right. It all comes down to who the culprit is. Fusobacterium necrophorum, the most common one, it usually responds to beta-lactam antibiotics.
Beta-lactam, so like penicillin and its friends. Are there other options?
Yeah, there are. Metronidazole and clindamycin are also good choices. But we have to remember those co-infections and make sure we're picking antibiotics that can handle a bunch of different bacteria.
So sometimes we might need to use a combo of antibiotics.
A lot of times, yeah. And we can't forget about that elephant in the room, antibiotic resistance.
Oh yeah, that's always a challenge for us, isn't it? How does antibiotic resistance impact Lemierre's treatment?
Well, F. necropforum's response to different antibiotics can vary. We might run into some strains that are resistant to the usual stuff.
So it's not a guarantee that a specific antibiotic will always work.
Exactly.
So we have to adjust our treatment based on which bacteria is causing the infection and how it responds to different antibiotics. Medical microbiologists are really important here.
Definitely. We're the ones tracking those resistance patterns and helping doctors choose the best antibiotics for their patients.
It's teamwork, really. Lab and clinic working together. So let's switch gears a bit and talk about prognosis. What's the outlook for patients with Lemierre's? What are their chances of getting better?
The good news is that Lemierre's has a pretty low mortality rate.
That's good to hear.
Yeah, it's about 4.6% if it's caught and treated early. Early diagnosis is key.
So all that stuff we were talking about before, about how hard it can be to diagnose and those delays, that can really make a difference in how someone does.
It really can. If we don't catch it early, because it's rare or because the symptoms are sneaky at first, it can lead to much worse outcomes. Getting those antibiotics in there quickly is the best way to prevent those scary complications and give people the best shot at recovery.
A real race against the clock. I think it'd be helpful to get a little historical context here. Can you tell us a bit about how we came to understand Lemierre's syndrome?
Sure. So way back in 1918, a guy named Schottmüller was the first one to really document cases of sepsis happening after a throat infection. But it was Andre Lemierre, the guy the syndrome's named after, who really put it on the map in 1936.
So what did Lemierre find?
He was really thorough. He wrote up 20 cases of throat infections that were followed by what he called anaerobic sepsis. And sadly, 18 of those patients died. Keep in mind, this was before we had antibiotics that worked.
Wow. That really puts things in perspective. It shows just how serious this condition can be, especially before we have the treatments we do now.
Definitely. Lemierre's work was a wake-up call. It made people pay attention to this complication of a sore throat that they hadn't really noticed before, this thing that could be fatal.
So we've learned a lot since then. How does understanding the history of Lemierre's change how we approach it today?
Yeah, I mean, that's the big question, isn't it?
It is.
How do we deal with this in the age of resistance?
Right.
And it's something that researchers and clinicians are, trying to wrap their heads around. Because as we see more and more cases of F. necrophorum that's just not responding to the usual antibiotics, what do we do?
Yeah, what do we do?
Our current treatments, they might not be enough anymore.
Right.
We have to be ready for that.
Yeah. It's a little scary, honestly.
It is.
So what can we do to tackle this? I mean, what's coming down the pipeline?
Well, on a big picture level, we've got to keep pushing for responsible antibiotic use.
Okay.
That's like the #1 thing to slow down this whole resistance train.
So that means educating doctors and patients about when antibiotics are really necessary.
Yes.
And making sure people take the full course.
Absolutely. Those messages are so important.
They really are.
And we've got to invest in research, too.
Yeah.
Finding new antibiotics that can actually take on these resistant strains. That's where medical microbiologists really come in.
Yeah, pushing the boundaries.
We're on the front lines of this battle.
Are there any other treatment approaches that are being looked at? What about phage therapy? I feel like that's getting a lot of buzz.
Yeah, phage therapy is really interesting.
Yeah.
Using those viruses that can actually infect and kill bacteria.
Right.
That could be a game changer for those resistant infections.
So there is hope.
There's definitely hope. But we're in a race against time, that's for sure.
Yeah. It sounds like the future of Lemierre's treatment really hinges on us staying ahead of this antibiotic resistance curve.
You got it. It's an ongoing battle.
Well, listeners, we've covered a lot of ground today. I hope this deep dive into Lemierre's syndrome has really underscored the importance of staying vigilant, making those careful diagnoses, and keeping up with the latest in infectious diseases.
Absolutely.
It's amazing how something as seemingly simple as a sore throat can actually have such serious consequences.
It really is.
We talked about how important it is to keep Lemierre's in mind, even if it doesn't seem obvious at first. A thorough patient history, lab tests, and imaging are all key.
Right. It's all about connecting those dots.
Exactly. And we can't forget about those antibiotics. Getting the right ones in there as quickly as possible can really make a difference.
It can be life-saving.
As we move forward, it's crucial that we stay aware of this antibiotic resistance issue and advocate for responsible use and research into new treatments.
Couldn't agree more.
So the next time you see a patient with a sore throat that's hanging around, think about Lemierre's. Keep that in your back pocket.
Yeah, don't let it slip your mind.
Stay curious, stay informed, and keep those microbes on your radar.
Always is.
Thanks for joining us on this deep dive into Lemierre syndrome. Until next time, keep exploring the amazing world of microbes.